there, my name is Sarah Smith, and I will be presenting my third informative speech to all of you. My audience here is my best friend Elizabeth Butler and my amazing husband Jordan Smith.
Hello.
Mindfulness, the path to equilibrium. Do you ever feel like you've lost your mind? Have you ever walked into a room with a goal in mind only to completely forget it the second you step in the door? Well, believe it or not, there is a term for this. That term is mindlessness. To be able to overcome this feeling, you have to attain mindfulness in your day-to-day life. Today, we will breathe in the history. Next, exhale the modern-day definition and uses of mindfulness. And finally, come to peace with the benefits. During my time in dialectical behavioral therapy, DBT, the term mindfulness was crucial in the development of my new and improved self by incorporating mindfulness techniques in my day-to-day life that I learned over the past few years. To be able to understand mindfulness fully, we must take our first breath in history. Mindfulness is a concept that derives from Buddhism over 2,500 years ago. Author Sifu Kwan mentions in his book, Mindfulness in Early Buddhism, that the holy text even states that those who have undertaken the four establishments of mindfulness have undertaken the noble path. The four establishments of mindfulness suggest that one shall remain established in observing their feelings, mind, and objects by possessing clear understandings of such things and abandoning every craving and every distaste for this life. It was not until recently that other religions and modern-day psychologists started using these four establishments. Brother Lawrence, a Christian monastery from the 1600s, believed that mindfulness meant to be in touch with the Holy Spirit. He even mentions it in his book, Practicing the Presence of God. Islamic religious leaders also mention mindfulness through muraqabah, an Islamic meditation. It was not until the 1970s when mindfulness came about the United States. It was introduced by a man named John Kabat-Zinn, an American professor of medicine who created a stress reduction clinic at the University of Massachusetts. At first, the stress reduction clinic was built off the four establishments, the Buddhist theory. However, Dr. Kabat-Zinn changed it to a more scientific base of teaching and renaming his clinic Mindfulness-Based Stress Reduction Clinic. Now that we have inhaled the history of mindfulness, we must exhale to discover the modern-day theory and uses. According to the Oxford Dictionary, mindfulness is defined as a mental state achieved by concentrating on the present moment while calmly accepting the feelings and thoughts that come to you. Used as a technique to help you relax. According to an article on the website Mindful by author Stephanie Talaka, mindfulness is no longer considered a soft skill, but an essential part of overall healthcare. In the past year alone, we have seen a shift from doctors prescribing medication to treat ailments to physicians prescribing outdoor play, trips to the museum, and mindfulness to treat pain, loneliness, anxiety, and burnout. The article further discusses how mindfulness-based therapies are being put into place to help patients with PTSD, depression, and even chronic pain to undercut the opioid epidemic. One familiar mindfulness-based tool therapists teach their patients is called Wise Mind. Psychologist Laura K. Schnick explains the Wise Mind in her article, What is Wise Mind?, as the balance between reasonable mind and emotional mind. Essentially, what this means is that you allow yourself to be emotional without being too caught up with your emotions, or reasonable without being apathetic. Wise mind includes intuitive thinking, the arrangement between rational mind and emotional mind, and living mindfully. For example, my husband and I get into heated arguments occasionally. We have been able to incorporate the skills I have learned through dialectical behavioral therapy, DBT, which looks something like this. When my husband and I are extremely angry with each other, we have learned to take time out to avoid saying something hurtful to one another. Timeouts allow us to take deep breaths alone, all while intuitively thinking what it is that we want to talk to each other about when with a calm-mannered persona. Wise mind is such a simple concept, yet many struggle with practicing it, including myself. Still. However, practicing this skill in less severe scenarios will prepare you to use them in more severe ones. Outside of using wise mind, there are many other ways you can practice mindfulness, such as yoga, meditation, and getting adequate sleep each and every single night. Since we have learned the history and definitions of mindfulness, let us finish off with the benefits. While there are many benefits, we will evaluate and focus on the top two: stress reduction and decreasing depression. The first benefit is stress reduction. The American Psychological Association explains a study that happened in 2010. Dr. Hoffman analyzed 39 studies that explored the use of mindfulness. The article states, those findings are consistent with evidence that mindfulness meditation increases positive effect and decreases anxiety and negative effect. In one study, participants were randomly assigned to an 8-week mindfulness-based study called Stress Reduction Group. Researchers discovered that a participant in the group had lower anxiety and depression levels than those in the control group who did not participate. This discovery is vast because depression, anxiety, and stress are all struggles a plethora of people deal with every day. The second benefit is decreasing depression. The University of Exeter conducted a study in 2015. In this trial, 424 adults with recurrent major depression and taking maintenance antidepressant medication were recruited from 95 primary care general practices across England's southwest region. Participants were randomly assigned to slowly taper off their antidepressant medication and receive mindfulness-based cognitive therapy or stay on their medication. All participants were required to attend 8 2.5-hour group sessions daily, but to do their assigned work daily. Furthermore, only 4 months after starting, 3/4 of the patients felt well enough to stop taking their antidepressants completely. This study is such an excellent example of how effective using mindfulness can be. Mindfulness is a tool that can be used by anyone and everyone. Today, I have shared with you what mindfulness is, a concept that allows a person to acknowledge their present self, the history starting with Buddhism to modern day theory. Finally, the benefits it brings to a person's health. Mindfulness can allow a person to become less stressed and depressed. The dedicated Buddhists that have practiced mindfulness for centuries have not only learned how to be present at the moment, but have also passed down and taught an abundance of diverse people to become better versions of themselves. To close, let's all just take a big, deep breath in and exhale to a calmer self. Thank you.